Narcan saves lives. Narcan has saved my own life.
Everyone should be carrying Narcan. It reverses an opioid overdose.
It's easy to get. It's almost at any pharmacy. You don't have to be 18, and you don't need a prescription.
It is saving lives every single day.
It's Not Your Fault is a podcast for parents, caregivers, and young people navigating the world and its challenges. Here's your host, Brandon Jones.
Greetings, everybody, and welcome back to another installment of It Is Not Your Fault, a teen mental health podcast. I am your host, Brandon Jones, and on today's episode, we're going to talk about teen mental health and substance use. Yes, teens are getting high and using substances. I know we don't like to have this conversation, but it is a reality, and we do need to pay attention to it. So we're going to talk about it on today's podcast. Recently, I came across a news article that led to a research study that is currently being done by the Center for Disease Control. And the article was put in ABC News, and the article is entitled, "The CDC Launches New National Campaign to Tackle Mental Health and Substance Use Amongst Teens." The number of teens reporting poor mental health has risen in the past decade. So between now and 2015, youth mental health has been on an increasing rise for pretty much all demographics of young people. No matter if you put a race factor, an ethnicity factor, a gender factor, or even an age factor, we have seen mental health on a consistent rise across the board. Some groups are having more mental health challenges than others, but overall, there's been an increase in youth mental health. With increase in youth mental health, unfortunately, we get an increase in substance use. People are coping with the struggles that they're going through. Young people are smoking weed. They're drinking alcohol. They're popping pills. Okay? They are into codeine and lean and all these other things. They are utilizing substances to survive. And again, it's not a comfortable situation. It doesn't even make me comfortable, but it's happening. You know, I used to check with my own kids and I would ask them if they knew certain things about drugs. I would use common street names of drugs to see if they knew what these things were. And I used to get a lot of no's. Like, I have no idea what that is, Dad. I don't know what you're talking about. But recently I've gotten yeses. I have a mental health. I have a middle schooler. That might have been our Freudian slip. I have a middle schooler who's been exposed to a whole new world now that she's in middle school. So conversations around sexual activity are more common, and drugs are more common. She knows what this stuff is now. So when I ask her, hey, do you know what a perk is? Or I say, do you know what weed is? She always has known what alcohol is because she's seen it just around her family. Nothing in a abusive or addiction level state, but wine is around and other types of alcoholic beverages, beer, things of that nature. So she knows what alcohol is. We used to call it big people drink in our family. So the holidays come around, that's when the big people drinks come out. But now she knows what drugs are, and it's a different type of conversation. Now, do I think my child is experimenting with drugs? No, absolutely not. I don't have any suspicion there. But the awareness is there. And that's why it's important to you. Even if you don't have suspicion that your child is using any drugs, the awareness is there. Your adolescent knows what these things are, so that means you need to know what these things are. You need to know what the new versions of them are, the cool street names of these things. The drugs of today are very different than the childhoods that we have had as adults and that our parents have had as well. The drugs are different, so it's important for us to know. All right, let's get into some of the content of the actual article. So the article states, I'm going to read a little bit from the article and I'm going to give my perspective on it here in a second. The Center for Disease Control and Prevention, the CDC, launched a new campaign on Tuesday. This is a few days ago, aimed at tackling mental health and substance use amongst teens ahead of the upcoming school year. The federal campaign is entitled Free Mind, aims to prevent teens and their parents or caregivers, aims to provide teens and their parents and caregivers with resources and information about substance use, mental health, and the connection between the two. The effort revolved around the messaging that drugs and mental health don't mix, according to the landing page of the new campaign on the CDC's website. On that landing page, it states, when you deal with lots of emotions, you might be tempted to turn to drugs and alcohol or cope by misusing medications that are not prescribed to you. Substance use, however, can cause worsening anxiety, sadness, anger, and depression. According to the CDC, it also affects a patient's memory and mood. So the thing that all people, but we're going to talk about young people today, young people may use to cope with their mental health can also cause further mental health issues, which are drugs. So we want to keep drugs out of the hands of kids, obviously. We want to keep drugs out the hands of adults as well. The CDC describes drug overdose crisis as a consistently evolving and an important public health issue. More than 80,000 Americans died from a drug overdose last year, 2024, according to CDC data. The last 4 years, 75% of overdose deaths amongst preteens and teenagers ages 10 to 19 involved illegally made fentanyl. So these kids are using opioids. 75% of the overdose deaths of preteens and teens ages 10 to 19 were caused to fentanyl. So these kids have access to drugs, unfortunately, and we've had overdose where people have passed. The number of teens reporting poor mental health has increased in the past decade, with 40% of high school students stopping regular activities because of the persistent feeling of sadness or hopelessness. In 2023, 1 in 5 students have seriously considered attempting suicide, according to the CDC. Teens may use alcohol and other substances to help them cope with stress, anxiety, and depression, said Dr. Allison Ardwadi. I think that's how you pronounce the last name, Dr. Allison Ardwadi. She is the director of the CDC's National Center for Injury Prevention and Control. All right. So again, that's just some from the article. I'm not going to read the whole thing to you, but it's letting us know that we have a problem going on with young people and them utilizing substances to cope with their mental health struggles. Now, here are my thoughts on this article and what we can do as I give some strategies on how we can move forward, given the dynamic that we see with our children. So the CDC has launched this new campaign and this initiative called Better Talk, and it's designed to really help promote the well-being needs, both substances-wise and mental health-wise, for young people. This is not just a public health announcement, it's really a wake-up call. According to the CDC, nearly 60% of teen girls and 30% of teen boys reported persistent feelings of sadness or hopelessness in 2021. And we know the number hasn't gone down, it's just kind of continued on. The rates of depression, anxiety, and suicidal ideation have soared, especially since the pandemic. So the launch of this campaign, Better Talk, isn't just timely, it's very essential. We need this right now. We need our own in-home campaigns to better the impacts of children and them utilizing substances to cope with their mental health. But here's the truth. The national campaign, no matter how powerful, are only as effective as actions taken at home, in schools, and in community. So yeah, a national campaign is great, but we have to take action. That's where you, parents, caregivers, and youth workers, and trusted adults come in. Here's what we can do. You know me, I always like to give you some practicality and things that you can use today to better the dynamic with children. Number one, here are some things that you can say. One of the things let me back up. Here's how we can support people. Number one, here's something you can do. You can talk early, often, and honestly. Man, I can't stress this enough. I know I sound like a broken record here in the podcast because I always talk about being authentic and honest with their children, giving them age-appropriate information. It's so important. We baby our children. We think that they can't take things that they probably can. And it means we have to be active listeners and really lean in to figure out where they're at and how they are doing. So the CDC campaign emphasizes the power of talking. This doesn't mean that waiting for a crisis, but starting a conversation when things are calm. asking about their day, sharing your own struggles in age appropriate ways, normalizing talking about emotions, and most importantly, listening to them when they speak, listening even more to them when they speak. What you can say to young people: how's your heart today? What have you been what's been feeling heavy for you lately? I may not always have the answers, but I'm here to figure it out with you. These are all responses to young people that may help them open up about what's going on. Recognize signs early is the number 2 strategy that I want to offer to you all. Change in behavior, sleep patterns, academic performance, withdrawal from friends are all red flags. But also paying attention to subtle cues: irritability that seems irrational, perfectionism, even humor that seems to be a little too dark. These can all be signs of internal distress. Something may be going on with your child internally. Don't dismiss this as teen angst. Ask gentle, open-minded questions and create non-judgmental spaces for them to share. You need to be inquisitive with your child. You need to be curious on what's going on, what's not going on, what they're interested in, what they're not interested in. Create a mental health friendly environment is another strategy for you, not solution strategy. Teens need safe places, both physically and emotionally. Build a home or program culture that values rest, boundaries, self-care, and emotional expression, right? Some practical ideas on how to do this: have device-free dinners for reconnection. Eat with your kids. Share meals with your children. Model healthy coping skills: journaling, walking, deep breathing, moments to pause, prayer. Refrain from toxic positivity. You don't hear that very often, right? Validating their pain while offering hope is important, but don't give them false hope. Don't give them the toxic positivity. It doesn't go anywhere. Number 4, get comfortable with help. It's okay not to have all the answers. It's not okay to do nothing. Learn about local therapists in your area, school counselors, the folks who are at your school as we get closer to the school year. Very important to know who are those folks in my child's school, even if they don't have issues. And also crisis resources. One of the biggest things that you need to know right now is 988. 988 can be a life-changing opportunity for you and the young person in your life. It is a 24-hour crisis lifeline. They'll help you with all type of resources. Call 988 if you need it. Text 988 if you need it. The number's easy. It's 988. Can't lose it. Can't lose it. Support strategy. Normalize therapy the way that we normalize going to the doctor. Mental health is health. And my last tip for the day is partner with schools and community programs. So many parents are going at this alone. Your kids are at school almost more than they're at home. That's a fact. Your kids are at school almost more than they're home. You need to know who's in that building and how you can connect with them and make sure that your kid and all the other kids who may be in a situation like your child or children has the opportunity. So youth workers, caregivers often serve as a bridge between home and school. Make sure that mental health is a part of your youth's program culture if you work in schools. Advocate for school-based mental health resources and trauma-informed training for staff. Those things help. Don't wait for the crisis to show up. Do something now. Collaborate as much as possible. Host workshops, bring mental health speakers in like myself, offer wellness checks and wellness check-ins as part of the normal school day. Do something about it. Don't sit and wait. Why does this matter as we close out our conversation? The CDC's campaign is a recognition of what many parents and youth workers have been seeing for years. Our teens are in distress and they need us, not to fix them, but to see them, hear them, and walk beside them. The mental health crisis amongst youth is more than a moral failure. It's and one that we can all do something about. We all have the possibilities to make this change. Let Better Talk be just the beginning. This national campaign from the CDC is just the beginning. It's not just for a national conversation, but of a personal one in your home. Utilize this as an opportunity to have a conversation with your children, have a conversation with their school, have a conversation in your community. Talk. Don't do this alone. Because truth is, your willingness to talk might just be the reason a young person is choosing to stay. We all can do this work. Again, I want to give you all, again, the resource 988. If you need help, if you need words, if you need resources, go ahead and type, text, talk, whatever it takes. 988 is here to help. There's other things as well, local resources. Check in with your local nonprofits. Minnesota Association for Children Mental Health is another great organization that you can go ahead and just go to the website, www.macmh.org. Tons of resources there as well. You might see a familiar face at that organization. All right, folks, that's going to do it for me today. Speaking of resources and places to get connected, let me give you 3 places to connect with myself and this type of content. First is Facebook. Go ahead and type in It's Not Your Fault podcast on Facebook. You can put that in the search bar, find our site, click on it, add it, like it, follow it. You can get quality information and other resources right there on that site, right there on Facebook, on our page, not the site, on our page. That is It Is Not Your Fault, the Facebook page. Check it out. Second place, you can get to me on my personal website. That's jegna.org. That's where I do a lot of my consulting, and you can find other content and things there. That's www.jegna.org. That's jegna.org, jegna.org. You can get in contact with me there as well. And if you like this podcast, there's a good chance you're going to like the other podcasts we have on our network. What is the network, Brandon? The network is ShalettaMakesMeLaugh.com. That's ShalettaMakesMeLaugh.com. Go ahead and find me and a plethora of amazing podcasters right there on the network. Get informed, get engaged, and get in tune as best as you can. All right, folks, that's going to do it for me today. I want to encourage you to take care of yourselves. Be safe, be well, and be constructive. See you next time.
To check out previous episodes of It's Not Your Fault, or to learn more about Brandon Jones, log on to ShalettaMakesMeLaugh.com.
You know Shaletta makes you laugh, but did you know Shaletta Brundage can also make you think and boost your business? Media personality, activist, and comedian Shaletta Brundage founded Shaletta Makes Me Laugh to celebrate and share the best of Black culture. It's a podcasting platform. You can download 10 weekly podcasts hosted by African-American subject experts at ShalettaMakesMeLaugh.com or wherever you find your favorite podcasts. ShalettaMakesMeLaugh.com is also a production house, creating broadcast-quality commercial content. And Shaletta and her team of storytellers create powerful promotional campaigns to get businesses the brand awareness they're looking for. Some of Minnesota's top businesses trust Shaletta, and you can too. Get out the word about your events and products and get in front of communities of color with ShalettaMakesMeLaugh.com. She's got the power to help your business.
To keep my home running smooth, I count on Xfinity Internet. With 99.9% reliability, we're all online at once. No slowdowns. The Xfinity app lets me manage our Wi-Fi and keep things secure. Xfinity makes it easy.